Hi, my name is Michael Tweedy. I'm Andrew Noblett's veterinary surgeon. This is just a short video trying to explain roaring and why a horse will present with it and how it develops. So what is roaring? Roaring is a poor function of the larynx. It's a left-sided larynx problem in this horse, and that's the most common site for it to be affected. So when I describe that there, when we look at the throat, there's two cartilages on either side of the throat, the left and the right. Now, when I describe roaring, roaring is the ability or the lack of ability to fully abduct and hold the left side of the larynx open. Now, when the horse was designed, there's 5 muscles that pull it in and there's only 1 muscle pulls it out. The reason horses go roar on the left side is because the nerve comes out at the base of the brain, goes all the way down the neck, around the heart and back up again to innervate this one muscle. It's a progressive condition that can deteriorate over time, and also it can get to the point where it's the straw that breaks the camel's back. So sometimes a horse can be absolutely fine and coping fine with it, and then all of a sudden it just tips over the edge and the horse loses more and more ability to fire that muscle off, and they lose function of the muscle. So the muscle, when a muscle's not stimulated by a nerve, it decreases in size and atrophies and it falls down. So some horses will be absolutely fine for a couple of years or a year, and then all of a sudden the condition progresses. It may not have been it would not have been present at sale time. It would have only been a condition that develops over time. Some horses can go from absolutely fine to making a noise very quickly. Other horses can take many months or years to progress and get to that failed function. Not all horses do. Now, the incidence of it in the population is somewhere around 10 to 20%, depending on the studies you look at. So when we're doing, so those horses that suddenly present, we look at that, we do a resting endoscopic examination in combination with the nerves and poor performance, you'll see an inability to fully abduct. Now, what that means is if there's an inability to fully abduct and hold that out when a horse is breathing and galloping, they need the full airway to get air, oxygen in. When horses lose that ability, what happens is as the horse is breathing in and sucking air in, it can't hold it out, so it gets pulled in. So it actually occludes the airway. So when we do dynamic endoscopes on these horses with a scope in place when the horse is galloping, what you'll find is actually not only can they not get it out, but they can't hold it out and stop it coming in. And you need to tie it back. So the skill then in the surgeon is to tie it back far enough without getting any post-op complications. So it's unfortunate that this condition is progressive, and it is a certain percentage of the population will progress and develop it, and it's very hard to sort of predict which ones are going to progress. Some horses will stay static at a certain level and not change over time, and that'll be fine. Other horses can progress very quickly. I myself have scoped horses that have been fine one day and 4 weeks later are gone. They've lost function in that there. And basically what it is because the innervation gets lost to the muscle, and the muscle gradually deteriorates over time, and less nerve fibers less and less nerve impulses get into the muscle, and the muscle deteriorates and weakens, and then all of a sudden you've got the problem. So it's an unfortunate condition, but hopefully this explains why a horse can go from being fine to being abnormal, and it is the nerve isn't functioning properly and gets damaged, and all of a sudden you lose that muscle function. So it's very unfortunate, but that is the condition. Thank you very much. If you have any questions, please pass them on to Andrew. Thank you.